Alarcon, what is Renessa?
Renessa is the transurethral thermotherapy of the bladder neck that really takes care of the moderate and minimal stress urinary incontinence.
Which patient should consider Renessa?
Well, the patients who has a minimal cystocell, the patients that I will describe as probably type 1 and 2 stress urinary incontinence.
Feel that this is a really good first-line therapy that you would recommend to your patients prior to going to surgery?
Well, for the right patient, absolutely.
Yeah.
For the patient who has minimal cystocell and stress urinary incontinence in grade 1 and 2, it's a great procedure. Even in the young and elderly patient, And people don't want to have surgery immediately. Most of those patients are, even though they're the borderline, sometimes they will ask the doctor, why don't we try this first, and then if it doesn't work, we can do the surgery. So I said, absolutely, and to my surprise, I have been working even in the borderline patients that, that probably will need surgery.
And can you describe the procedure?
Well, it's a very simple procedure. Really what we do is we numb the urethra, and then we use a special instrument that actually is done through the urethra, and the instrument has actually a few needles that get into the bladder neck, and it takes about 15 minutes, and usually we do some heating of the bladder neck, and then we do some heating of the middle urethra.
Patients don't feel any pain?
The patients have no pain. The local anesthesia works really well, and it's almost like doing a cystoscopy.
And when do patients usually see the results or see any improvement?
Well, to my surprise, I used to tell them that it would take probably a few weeks or months, and sometimes the patients come back after a week and they say, doctor, my problem is gone. So it's taking less time than I thought.
How do you perform Renessa?
The procedure is done in the office, on the local anesthesia, and the patients tolerate very well, and we're getting excellent results.
And when do your patients usually go home?
Usually they go home after the procedure, after they get dressed, and that takes probably about 15-20 minutes after the procedure for them to go home.
What is your name?
Yadira
Why did
Morales.
you choose Renessa?
Well, because Dr. Alarcon highly recommended, and I am hoping that it's going to
What
work.
symptoms do you have?
I have uncontrollable urinary problems.
And what kinds of activities does the incontinence affect?
My entire life,
Yeah.
my entire activities.
Concerns about Renessa?
The only concern that I have is that I'm really, really, really hoping that it
We
works.
explain the needles. We're going to be starting our first treatment. So we're doing actually a third lesion in the bladder neck. What we're doing at the same time, we're actually filling up the bladder, so the bladder is getting full. And everything looks that is working fine. As you can see, the patient has no pain. So actually the whole procedure takes about less than 10 minutes.
Mrs. Morales, how do you feel now that you just had the Renessa procedure?
I feel okay.
Yeah? Great.
Okay.
Did you feel any pain?
A little bit of soreness,
Yeah?
but other than that, nothing.
Yeah? Very tolerable?
Yes, it was tolerable.
What do you think of the overall procedure?
I think that it's wonderful because it's given me a chance to change my entire life in everything that I do.
Yeah. What do you think of Dr. Alarcon?
I think that is a blessing from God because it's given me the opportunity to change, like I said, to get well and to continue with my life the way that I'm supposed to.
Oh, that's when will you be able to go home?
I'm going home right now.
Great. Thank you so much, Mrs. Morales. We really appreciate your
You're more
your
than
time.
welcome. You're more than welcome.